there's certain red line. You have to have the strength of character. You might even make them pretty angry or pissed off at you or whatever.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast series presented by the American Journal of Healthcare Strategy. I am joined today by a very esteemed and accomplished guest with a wealth of experience, both in the clinical and the leadership side within our healthcare system, and a lot of really cool and interesting uh, areas. So, Dr. Robert Darling. Dr. Darling, do you mind taking a minute or two to introduce yourself and tell us a little bit about your experience and how you got to where you are now?
Sure, Zach, happy to. Yeah, so Dr. Rob Darling, I've been practicing medicine almost 40 years now. I spent most of my career in the United States Navy. I was 25 years active duty. Um, Started in Bethesda, Maryland at the Military Medical School, the Uniformed Services University. Graduated 85, and 25 years in the Navy, initially as a flight surgeon, then residency in emergency medicine. I had a host of just fabulous assignments that I think we're gonna talk about. I left active duty in 2006, and started the second half of my career, if you will. And I'm still at age 66. I'm still practicing. I've got my own business that I'm involved in, and I'm doing all kinds of fun things.
One of my favorite stories, and from one of our previous conversations, Dr. Darling, was you told this story of getting an opportunity to ride in the back of an F-14 Tomcat, and I think you would be hard pressed to if you were to take a poll of people around the world, specifically around the United States of America, who aren't insanely jealous of that chance, especially if you've seen Top Gun, Top Gun 2, any movie with a plane in it, you know just how cool the F-14 Tomcat is. So I'm curious though, besides an incredibly cool experience, what did why did you do that? What additional information did you gain that impacted your role and your clinical care and your administrative decisions that were made?
Well, as I said, Zach, having attended the nation's military medical school, the Uniformed Services University, I was there with I was Navy, but I was there with my Army, Air Force, and a few public health service colleagues. The whole purpose of the medical school is to train to take care of the warfighter, right? So early in my career, after I finished my internship during that time, the Navy said, "Hey, you're not going to go to residency right away. You're going to do it, and you're going to go out. You're going to go out to the fleet. You're going to go on a ship. You're going to be an undersea medical officer. You're going to be a flight surgeon." And so I decided, a flight surgeon sounds good. So I chose that path. Right after my internship, well, actually, I did 6 months in the ER first, and then I went to the Naval Aerospace Medical Institute in Pensacola, Florida. This is where young naval aviators begin their basic flight training, and that's also where young Navy doctors go to learn the how to become a flight surgeon. And a flight surgeon is a doctor. We're not surgeons, well, minor stuff, but essentially we become aero medical specialists. So we take care of naval aviators, um, because there's a lot of stresses on the body with particularly with the area I chose. I chose to go on the aircraft carrier USS Theodore Roosevelt. So this is a Nimitz class carrier, a 1,200-foot long ship, 110,000 tons, 6,200 men, 100 airplanes. And one of the things that I was charged with was, all right, we want you to understand what it's like uh, landing on an aircraft carrier. So any airplane that had two seats or more, I would fly in. And of course, this was 1986 when Top Gun came out, and of course, flying in a fighter aircraft So I got 25 carrier landings during my 2 years on board the Roosevelt. And I also flew in the A6 Intruder. So in the F-14, I was in the back seat. In the A6, it was on the right seat. Pilots in the left seat. And I flew on some of the other airplane as well. So yeah. And again, the purpose of that, I got to experience, air combat maneuvers, landing, taking off. Is very physiologically taxing, and it helped me take better care of my patients, my naval aviators.
I think, like I said before, I think that's an incredibly unique experience. Very, very super cool just to get the opportunity to fly in that wide variety of planes, but also just to get the opportunity to experience what your patients were experiencing on a regular basis in their regular lives in their regular job. And I think that that's an interesting thing I want to camp on just a little bit. And I'm curious, obviously that's a unique situation. Not every clinician and physician is taking care of these aviators who are flying these multi-million dollar jets and airplanes and landing on an aircraft carrier. It's a unique, stressful situation there. But what are some ways that your clinicians and your physicians and your administrators can grow in their perspective of what their patients are going through, and get a better idea of the patient perspective, and how will doing so affect the decisions that they make? I'm curious if you have any thoughts on that.
Well, yeah. When you think so, again, being on that, so when I would fly with them, I was part of the mission. And For example, when we were flying in the North Atlantic over very frigid waters, I'd have to put on the dry suit,
Mm,
not a wetsuit, a dry suit. And a dry suit is it basically is you're wrapping yourself in rubber so that if you were actually had to go into freezing water, you would live. So this is like a suit that on your neck, on arms and legs is a piece of rubber that prevents the water from coming in. So it's very, very hot. So we would go and fly and do air combat maneuvers, and in an hour and a half's time, when you got back to the boat, your body you were beaten up. I mean, you lost probably a couple of pounds in sweat. I mean, you were completely drenched from that. And again, the purpose for me was to understand this is what my air crew are going through. Or, for example, maybe you got a minor cold, a little, yeah, yeah, might be a big deal, a cold, right? Well, when you're in a pressurized aircraft, landing on a boat at 140 knots, a little minor cold, if you can't clear your ears, it could be a disaster. You could blow. I've had guys blow out eardrums because they didn't tell me.
yeah.
They didn't tell me they had a cold, and they couldn't clear. And so anyway, you learn the perspective from the patient, from your air crew, and you learn how to take better care of them
Mm.
as a result.
So for your non-military physicians, how can they grow to better understand the patient perspective?
So even we remember I started practicing in 1985. That's a long time ago. Yeah, we had technology then. We had some decent technology. We got incredible technology today, right? But
Right.
guess what? I am not, I think AI, as we're getting into AI and quantum computing and all that kind of stuff. You know what? It's going to be a long time before me as a clinician gets replaced by a computer or a robot, because at the end of the day, it's about your patients, your clients, patients, clients, having trust in you, the human clinician,
Right.
um, uh, being able to communicate. I tell all these young people, when I text, put it down, give me a call. Let's have a conversation. The art, particularly the younger generation, everybody's using technology to communicate, but when it comes to healthcare, particularly when you have to, compassion, understanding, it's about uh, direct communication with your patient and their family, right? Their families often. So that art, that and it is an art. It's becoming more and more an art to be able to communicate uh, with your patients on a very basic human level. I guess AI gets really really good, and robots get really. It's possible we might be able to get. You can say, well, this is a robot who's being compassionate. It's not a real human being. I don't know. We got some ways to go yet. So I urge all these young medics, PAs, doctors, nurses, whatever, to don't forget about basically like what we're doing right now, being able to do that and do it well.
Right. Well, and that's you mentioned I think you've nailed on the head the importance that and the perspective that a clinician brings of understanding like, hey, it's this interaction between you and me that matters most, and really guides the whole care visit regardless of the situation. It's the physician and other clinicians interacting with the patient, and that is where a lot of the decision making comes from.
I know, I know, particularly in civilian medicine, um, well, we have to document what we do, right? We have to, but I can't think of anything more annoying because this happened to me. And it's just the nature of the way medicine has gone with the electronic medical record. Is
Mhm.
I come in and I see my doctor, and you know they're
Right.
not really looking at me. They're asking questions, but they're documenting everything. And so I guess we started using, and I've never used one myself, but we've got these scribes these days,
Hmm.
that's a good thing. And they so the doctor patient, we're talking. There's a scribe over there documenting everything, and I imagine that'll be one of the benefits of AI, that maybe the conversation the patient has to agree. You record it, and then the AI cuts it down into a concise, nice note that you can quickly read. All right, we've documented this, but at least I had this. What we're doing right now, you know.
I'm curious. We've talked a little bit about just the extensiveness of your career working in a variety of different fields within the medical field. And over your the course of your career, the medical field has changed dramatically. I mean, you've told stories of flying in an F-14 Tomcat in 1986, and here we are in 2025 talking about AI, scribes, and new advances to technology that are the future of medicine, as one may say. How do you stay on top of a field that has changed so dramatically, especially in serving in some of the areas that you have, such as these high pressure situations, as serving in the military and in the White House? How do you stay on top of an ever changing field?
Well, look, it's that part is never going to change. It's well, thankfully, we have these smartphones where we can have everything. The good news is, when I was in medical school, we memorized a lot. We just constantly, memorizing. I can remember we would spend hours with making our own 3x5 flashcards with notes. Now we've got this wonderful thing, right? But the end of the day, it's reading. I read. I'm a voracious reader. Actually, between reading, but also um, I do a lot of audiobooks, and I do that while I'm walking my Weimaraner, who we both need the exercise. And so I listen to journal articles. I do books that usually, depending upon the nature, at 1.5 or 1.7x with my earbuds in while I'm walking at a really good clip. So I'm getting my exercise done, and I'm getting information that way. But also, I still getting together with colleagues and having discussions. That is, you know, colleagues on the same plane who we talk about whatever the new topic is, and really others who have thought about it, and we compare notes, if you will. So that part, you just have to really put your nose to the grind, and read journals, read books, and have colleagues that you can bounce things off of.
No, I think you highlighted two very important and critical components of anyone within really within any profession, but especially the medical field. Just the importance of being a continual learner, always learning, always striving to update knowledge, to reinforce knowledge, continuing to grow and expand that knowledge base. And then recognizing that while we are growing and learning, and while individuals are very smart and accomplished, they're not they don't know everything, and it's impossible to know everything. And so recognizing the importance of colleagues and having individuals that you can lean on and you can ask questions to and hear perspectives. And because it's a dangerous thing if we ever find ourselves thinking we're the absolute smartest in the room. That's not a spot that I personally want to be in.
I've actually been practicing just testing out a little bit. Is Chat GPT.
Okay.
Well, I will ask it a fairly complex, it's something I know the answer to, a question, a complicated clinical problem, and I've been really blown away by, for the most part, the accuracy, and it's just an amazing technology. I never even would have thought this was possible, but there it is, there it is. So
To pivot just a little bit, I'm curious to hear, you've worked in some high pressure situations, taking care of the crew on an aircraft carrier, taking care of those naval officers and those Navy individuals, and working in the White House and having some taking care of some pretty important people there too. And I'm curious, in both of those fields and in your current position, you're taking care and you're leading a team in in a world that, like we said before, is constantly changing and constantly evolving. How do you ensure that your team remains resilient and adaptable in the
yeah,
face of these rapid changes? Because it's one thing to personally be resilient and adaptable, but how do you encourage that perspective across the team?
sure. Well, yeah. So you brought up the White House. So I was the first. I was honored to be the first emergency medicine physician to be selected to serve the President of the United States. That happened. I got the call in 1995 by the Surgeon General's office, Navy Surgeon General's office, that a position was becoming available at the White House during the Clinton administration. And essentially, 10 of us raised their hands if they would be interested. Three of us got interviews, and I won. So that was pretty kind of cool. So I was the first ER doc. It's, in part that's because emergency medicine, relatively young specialty. Um, Typically it was family medicine, internal medicine doctors, general surgeons. But anyway, got there, I had already done my residency. I was already board certified. I had practiced for several years taking care of United States Marines at Camp Pendleton. And um, I had to go through a very, very vigorous security clearance background. It took 8 months. There's all kinds of great stories associated with that. We don't have time for that right now. But um, no, I mean, I was there. Our job, the White House Medical Unit, which I was a part of, one of five physicians. There were, and then another 20 or 25 nurses, paramedics, corpsmen. There's 25 or 30 of us during from 1996 to 1999 when I was there. And yes, I took care of the President of the United States, President Bill Clinton, and First Lady Hillary, and Al Gore, Vice President Al Gore, and their families, and the cabinet. And I think it's the team approach is you got to be on top of your game. You got to be on the very, very tip top of your game, but you also have to be able to put in perspective that the president of the United States, he's the president of the United States, but he's still a human being with all the same. And there's a tendency, in fact, there's books written about it on my shelf here, talking about how throughout history that prominent individuals, politicians, Hollywood, alien, whatever, in fact, don't get the standard of care. They get special care, which typically we cut corners because they're special. You can find it throughout history. There's a great book that everybody should try. It's called When Illness Strikes the Leader, written by a friend of mine. He's now deceased, a psychiatrist from George Washington University. He studied this throughout history, how leaders have gotten. And we were when I got there, we talked. I was very early, first thing on. we obviously he's the president. We treat him with utter respect. We do everything. We cross every T, dot every I, but we still do it. He's a patient. He's a human being, and that had to be, up and down the chain of command. As a military organization, chain of command, very important. Everybody, I'm the doctor, you're the nurse. Now that said, everybody has an observation. It's just like today, when the code occurs. The old days, oh, the doctor would call it. Well, what happens today? Before you call a code, if you're doing your job right, the physician's usually the one running it. But before we say the patients, we're going to call this, you go, everybody in the room.
Mm.
Hey, Zach, you see anything? Did we make, every now and then it's the most junior person in the room has something important to say. And so that's very, and we practice that at the White House, in the White House medical unit. So.
Well, and in that situation with the code, that most junior person might have something to say that could result in a life being saved, and that's just speaks to the importance of creating this atmosphere that encourages everyone having an opportunity to share something that they think would be beneficial, and to speak up when they have an idea that could better serve a patient, whether that's in the code situation or just in an everyday clinic situation. And so, Dr. Darling, I have one more question before I let you go today. Um, I'm interested in a wide variety of experience that you've had serving, on the aircraft carrier, in the White House, and then now in your current role doing some really cool things. I'm curious, could you share an example of when your leadership was tested and how you handled and responded to that situation?
Well, there are instances where patients uh, want you to do something that is wrong, and I mean, it might be something as simple as the most common thing is patients coming in and with an upper respiratory infection and insisting, oh, they we all know it's viral, and they want antibiotics.
Yeah.
And I mean, I can remember having that conversation a couple of times with President Clinton, where he said, "Doc, don't you think? I mean, really?" And that was fairly early in the career. He had a cold, and it was clear, he didn't have a fever, just everything, pulse oxygen, and Doc, my other doctor always used to give me antibiotics. He says, "Oh, Mr. President," and I went into the long discussion about viruses and all that kind of stuff. Now that's kind of a minor case, but there are similar. I guess the point is that you're going to be your patients will test you from time to time, and I'm not saying that you can't negotiate certain things, but there's certain red line. You have to have the strength of character. You might even make them pretty angry, or pissed off at you or whatever, but you have to you at the end of the day, you've got to do the right thing. And it's not always going to make everybody happy, but yeah, that's happened lots. I can't think of anything more right off the top of my head that's a better example of that, but I think that's a pretty good one.
Yeah.
Telling patients, uh, educating them, and doing the right thing despite that they might want something else.
Well, and I think you highlighted just the importance of having integrity and being valued, and sticking to those values, especially as you are faced with tough situations, and having to respond to tough situations, and difficult people, and especially, I mean, doing so while still creating, as we talked about earlier, that atmosphere of where people can ask those questions, but recognizing that, hey, like, ultimately I need to do what's right, and having those values and that integrity to do so despite pressure from certain individuals or patients, or situations. So, Dr. Darling, we thank you so much for joining us today. I've enjoyed getting to just interact with you over the past couple meetings that we've had, just getting to hear your perspectives on how being a clinician in leadership has affected your career, and just the ways that you have served in some very cool ways, very, very jealous. I don't know if I said this before of you getting to fly in the back of an F-14 Tomcat. I know there's a lot of other people that share that sentiment with me. So, but we thank you for coming on today, and wish you the best as we get started with this 2025 year.
Well, my pleasure. Thank you for doing this. I'm in that stage of my career right now where I'm, in more mentor mode and giving back than I ever been before, and I enjoy doing this. So thank you, and uh, best wishes to you and all of your everybody who's watching this.